Welcome back to Telangana today. The topic of discussion today in this video is something very critical. That's the heart health. We have witnessed numerous cases of heart attacks in the recent times. Many lives were lost to these silent killer heart attacks with no warning signs. Most recent is the death of noted singer and Warehousing Corporation Chairman Sai Chand, who died of a heart stroke. The biggest problem is that we are always reactive to these heart problems, meaning we seek medical help only after the disease strikes you. From being reactive to proactive could make a difference between life and death. Though medical professionals are better placed to save lives now with the advent of new technologies, the arrival of artificial intelligence is changing the landscape of cardiology and opening doors to the new era of medical possibilities. Today we have with us one of the best cardiologists, Dr. Rajasekhar V, the senior interventional cardiologist from Yashoda Hospitals, to throw light on the new, exciting and emerging field of AI in detecting heart ailments. Welcome, Dr. Rajasekhar.
It's a very exciting development. The advantage of a CT angiogram as it is today is that not only does it tell you the extent of a block, but it will tell you there's a presence or absence of a block. So CT scan says there is no block, it is good news. So it's a very good sensitive test. But if there is a block, supposing it shows a 30% block or a 40% block or a 50% block, so how do we go about it? How do we interpret that? So existing CT scans, they have software embedded in them that will not only tell you whether there's a block or not, but they will also characterize the block, the tissue, the characterization of the tissue of the block. The block and we have to basically look at like a pipe with a reduction in the caliber of the pipe at any portion in the heart. So that is what we call a block. So what is causing that reduction? It can be just because of deposition of cholesterol. It can be deposition of cholesterol plus some tissue plus some cells. There can be deposition of calcium. Like different components go into the formation of a blockage inside the artery. If you can characterize that blockage, there are some types of blockage which are chronic, that are long-standing blockages, which have more of fibrous tissue and some calcium. These are actually stable blockages. So these blockages are less likely to cause an acute heart attack, less likely to cause an emergency. The blocks that are dangerous are those that are called vulnerable blocks. In English medical term, vulnerable blocks. These are blocks that have high burden of cholesterol. The high burden of cholesterol only, they don't have too much fibrous tissue. They have a lot of cholesterol, lot of inflammatory cells. There are cells that cause inflammation, and they are covered by a very thin layer of normal tissue. So this is called a thin cap vulnerable atheroma under medical terminology. So these are blockages or blocks which have high amount of cholesterol, they have a lot of inflammatory tissue, and then with a very thin cap. So whenever the pressure inside increases, this is what is called a plaque rupture. So this will rupture. So once this ruptures, a lot of these inflammatory mediators are released, which causes inflammation, and it also causes the blood to clot. So this clotting of the blood is what suddenly causes a 60% or a 50% blockage to become 100%.
Okay.
That is what causes a heart attack. So there is software in the CT scan, in the imaging technology to identify the composition of this blockage. But then if you add AI to that, and you feed it with millions and millions of data from interpretations from very experienced radiologists, like for example, obviously it needs some kind of a technical expertise. It obviously is AI, but you need a brain that actually feeds the data to the AI so that the AI gains the knowledge. So otherwise, if you you may not have, if you have 100 radiologists, not 100 of them may not be having the eye to pick up the nuances or the slight changes in the composition of the block to predict the nature of the block. So you get in the data which is got from thousands or hundreds or thousands of lakhs of scans, and then the interpretation of experts on this, and of all the data which is fed into the computer, into the algorithm. And the AI obviously learns everything very fast and implements that knowledge. And it is possible that the AI may be able to detect. Like the patient will have a normal CT scan, but the report is generated by AI because AI is using millions of algorithms, billions of combinations of data to qualify the composition of that particular blockage. And it is possible that it will be able to tell us, okay, this is a blockage. It's only 40% in patient A, but it's all fibrosis, it's all healed tissue and some calcium. So this is a stable blockage, does not require immediate intervention. But in the patient B, the same 40% blockage, but it looks like a vulnerable blockage which can rupture any moment. Any stress, any emotional, physical, psychological, or any other kind of stress can cause the block to rupture and cause a heart attack, which can be fatal. So if we can detect that kind of blockage, we can warn that particular patient B, oh, look, this particular blockage is only 40%. But then, unlike the patient A, is a 40% stable block, you've got a 40% unstable block. So you require intervention. So such a patient will obviously see a cardiologist. The cardiologist will do other tests. And if required, they will do an invasive angiogram. And after doing an invasive angiogram, also we've got invasive tools to further characterize the block. We have a device technology called optical coherence tomography. It is like a small miniature camera we pass inside the artery, and it does a tomography from inside. It's an optical coherence tomography. By light beam is passed through the blockage, and you actually identify even cholesterol crystals can be identified in that particular imaging. It's an intravascular imaging technology. So we'll identify the cholesterol granules. We will see it's a vulnerable block. And sometimes if it's a vulnerable block, even if it's 50%, we might be wanting to treat that blockage by doing an invasive procedure like an angioplasty or putting a stent may actually help such a patient. So the immense possibilities that AI can offer is that what 100 radiologists can do it in 1 hour, AI can do it for 1,000 patients in 1 minute. So I think that is the capability of AI.
Are there any instances where AI is tested in India, Dr. Garu?
The AI is there. AI is there in several fields of cardiology. So it's like a partial AI. There's a software which is incorporated in CT scans, which by means of the measurement of the caliber of the artery and all that, it will also detect the flow. The CT scan is not doing a pressure measurement, it's actually making a pressure calculation. So by making a pressure calculation, it's able to tell you that a blockage looks like a intermediate blockage. Is it significant or not? That virtual FFR, virtual flow assessment. Sometimes, supposing somebody has got a block which is about 60% or 70%, so which is like an intermediate block. Any blockage between 50% and 70% is called an intermediate blockage. So it may be there's a debate whether we need to treat them or we should treat the medicine or we should treat them with intervention. So one thing is, of course, if the blockage is a vulnerable blockage, we would prefer to treat them with intervention. But if the blockage is causing some flow limitations, we check the pressure in the artery before the blockage and check the pressure in the artery after the blockage. If there's a 20% fall in pressure, the pressure before the blockage is say 100, and if the pressure after the blockage is 80 or less, the 20% fall in pressure across the blockage, many studies have shown that it's a significant blockage and needs to be treated with an intervention. So earlier we used to do this invasively. We put a pressure transducer across the block and measure the pressure before and after. So that kind of a thing can be measured by CT scan. That's called a virtual FFR, virtual flow assessment. So this is also part of AI. So we feed into software, into the algorithms, into the CT scan, which by detecting the anatomy will also make an assessment of the functional significance. Similarly, AI is there even in robotics. They have robotic surgeries and robotic angioplasties, robotic cath labs. They are coming up now. So robotics also partly works on AI. So how it works is that basically a set of movements are fed into the robot. And the robotic instrument, which is actually performing the surgery or performing the angioplasty, is fed into. It's fed with some instructions about certain movements to be made, how to pass a balloon, how to pass a guide wire, how to deploy it. Everything that information is fed into the robo, and the robotic arm, which is there, which will incorporate those movements and will carry out the procedure with the cardiologist supervising from a distance. Because all this will help in. I mean, it is still in infancy. It is still in terms of cardiology. These developments are still in their infancy. In surgical field, the advances are pretty rapid because the advantage of robotic technology is basically AI. It's a form of AI. So how it helps is that in some places, supposing there is some artery or some particular organ you have to reach very deep, the hand may not be able to reach there, whereas a robotic arm can reach. It will have a 360 degrees arc over which a robotic arm can reach. So in areas where surgery needs to be done, where it is very difficult for a human hand to access, the robotic surgery will work very well. And sometimes in orthopedic surgery, there is perfect alignment of a joint. So a robotic thing can actually measure the angles much better, give you much perfect when you do a total hip replacement or a total knee replacement. A robotic arm can give you a much more precise alignment in some situations. Similarly, in cardiac surgery, some of the valve replacement surgeries, which are done by open heart replacement, by using a robotic technology, which is a very small incision, the valve replacement can be done. So this is the place where AI is coming up in a big way in treating heart patients. And మీరు ఇందాక చెప్పినట్టు AI has got an even greater role in predicting heart disease risk. So like there is, we have something called a Framingham heart model, and there's a model where multiple risk factors are put in and a scoring system is made by putting in several risk factors and giving a score for each risk factor. We get a certain score and it will give you a lifetime risk of heart disease, a 5-year risk of heart disease, a 10-year risk of heart disease. If you use AI and big data, so we get data from several populations across the world, across diverse ethnic groups, and we feed in all the data, we may be able to get an algorithm which will predict, okay, based on this data, in Indian population who are on this kind of a diet, this is the risk of heart disease. So that's where big data and AI will help us in formulating prediction models for heart disease risk.